In October of 2011, the AGA is going to sponsor a postgraduate course on GI oncology, and I think that this is a particularly good time to have a meeting such as this because there's been such a large amount of progress in the field over the past 5 years that it's pretty hard for any practicing gastroenterologist to keep up with the field. And in addition, there's a lot for people who are actively engaged in research in the field to offer, to learn about, and to exchange information. First of all, there's a lot of what's happened is that there are new techniques, endoscopic ultrasound and mucosal resections and that kind of thing that perhaps most people are pretty familiar with. But in addition, we're learning a lot more about the fundamental basis of gastrointestinal cancer. And this is leading into new diagnostic approaches and new therapeutic approaches. So we can't use the old paradigms to determine how we're going to screen people who are at high risk for, let's say, Barrett's esophagus or for colon cancer. We need to understand that now that we can divide colon cancers into several different categories of cancer, then we have to consider the unique ways of treating each one of these. So we need to understand terms like microsatellite instability and where it comes from. We have a good understanding of the hereditary forms of colon cancer, and the genes are kind of confusing to people, and it's good to be updated in that every couple of years because the progress continues and there's new things to know about that. The audience should be pretty broad. There will be an opportunity for people who are frontline clinicians to understand exactly what's happening and how they can direct their patient in the right direction, to a surgeon when that's appropriate, to a medical oncologist when that's appropriate, and to understand better what the medical oncologists are doing with cancer patients. People who are involved in research in this area usually get pretty deeply involved in one area, and this will be an opportunity for them to see in a broader way what's happening in closely related fields. People who are involved in education will have a lot to learn here too, because we're going to be putting more of the GI oncology into our GI training curriculum. So there's been a lot that's happened. It's an exciting field, and gastroenterologists can be more involved in the center of this by understanding more about cancer.